Well, good morning and welcome. I'm Julia Lear. I chair the board for the Cochs Community-Oriented Correction Health Services. Welcome to Health Reform and Criminal Justice, Integrating Jails into Health Information Exchanges. Thank you so much for joining us in this important conversation. We're here today to shine a light on what some would call the unseen healthcare provider, a crucial piece of the healthcare puzzle that is missing from the national conversation about healthcare policy and reform. It's also missing from the conversation around health information technology, a movement that is working to bring more and better health information into our efforts to improve healthcare and to bend the healthcare cost curve. The missing piece, of course, that I'm talking about is the 3,300 local county jails, which serve as a de facto safety net for some of society's most vulnerable members, including those who are poor, uninsured, suffering from mental illness, substance abuse disorders, and frequently are people of color. The jail-involved population has a huge impact on public health and on the costs of both health care and criminal justice. At Cochs, we talk a lot about connectivity, the building of bridges or links between jails and their communities. The goal, our goal, is to create medical homes for jail-involved individuals so that they can get the treatment that they need, be it in jail or in the community. Here are a couple of examples of what happens when you don't have connectivity. A recent study from Emory University found that 55% of U.S. jails, 55%, did not receive any H1N1 vaccine during the 2009-2010 epidemic, and thus more than half of an entire community was excluded from the national vaccine campaign. Another recent report found that people released from the New York City jails were twice as likely as other city residents to die of drug overdose or of homicide, especially in the first few weeks of their release from jail. These individuals are also at higher risk for suicide. So because of no connectivity, we have more disease, more crime, more preventable deaths, and of course, higher cost. For all those reasons, this is why it's so important to bring jails into the mainstream of the healthcare system. Health information technology can help us establish the connections we need. We need to get jails into the health information exchanges. And we need to have jails adopt electronic health record systems that will support the information exchange with their partners in the community. Currently, little of this is happening, but the potential Medicaid expansion of 2014 provides an incentive, regardless of Supreme Court decisions, to focus on strategies for bringing jails into health information technology movement. We need to build connectivity, and we need to build it now. And that's why it's so important to have this conversation today. We have an exciting agenda for you. In a little while, you will see an 8-minute documentary, which I've seen, and I think it will blow you away, The Unseen Provider, Healthcare in Jails. The Robert Wood Johnson Foundation commissioned this production to illustrate why it's so important to get health information technology into all of our jails. Our panel discussions will draw on issues raised in 6 background papers that I believe you all received prior to this meeting. We have allotted time for Q&A at the conclusion of each panel discussion, and we are relying on your active participation. The trustee Cochs staff is going to be roaming the aisles with handheld mics during each of the panel discussions, so please flag them down when you want to ask a question. You will also be given index cards, or you have index cards in your folders. If you prefer to write your questions down, please do so and pass them to the center aisle. Just a couple of other housekeeping items. The answer to the most commonly asked question is downstairs and to the right. A second reminder, please silence your cell phones if you haven't already. It will make it easier. Most of you are aware that the meeting is being webcast live this morning, so we can reach as many people as possible. You and your colleagues will be able to replay the video, we believe, as early as next week on the Cochs website. So if you want to share that information, we can continue to spread the word. Lunch will be held on the second floor of the Thunder Grill, right here on Union Station, I think you know. You will need your meeting badge to get in, so please wear your jackets if that's where your badge is. You'll find the blue meeting evaluation form in your packet. These are terribly helpful, as I think all of you know, because you've all done meetings. If it would help, start filling them out as you go along so you won't be choosing between getting to the airport and filling out the form. We are going to stay on time. We will move everything along so you don't need to worry about catching planes or moving on. My next task is to say a few words about our two speakers who are going to be introducing the program. They represent the foundations that have generously co-sponsored this meeting. Seema Gajwani from the Public Welfare Foundation and Nancy Barron from the Robert Wood Johnson Foundation. I want to thank both of them for their ongoing support of Cochs and for co-sponsoring the meeting today. Without them, this important work is not happening. Seema Gajwani joined the Public Welfare Foundation in 2007. She is a program officer for criminal and juvenile justice, and mainly in the last 2 years has been responsible for adult criminal justice issues. Ms. Gajwani previously worked in the Public Defender Service in Washington, D.C. Prior to becoming a public defender, she interned with the NAACP, Legal Defense and Education Fund. She also served in the Juvenile Justice Project of Louisiana and the Defender Association of Seattle. The Public Welfare Foundation supports efforts to ensure fundamental rights and opportunities for people in need. In their 60-year history, the foundation has distributed nearly $500 million in grants to 4,500 organizations. Cochs is delighted and honored to have their support. Nancy Barron is a senior advisor for program development at the Robert Wood Johnson Foundation. Since starting with the foundation in 1986, she has worked on a range of programming concerning healthcare policy research, financing, supportive housing for the chronically homeless, integrating community and correctional health, long-term care, and rural health care. Nancy has helped to develop a wide range of projects across the Foundation's vulnerable populations portfolio and its newer pioneer portfolio. RWJ has emphasized the creation of new opportunities for better health among vulnerable populations, with a particular focus on health disparities. We are grateful as well to the Robert Wood Johnson Foundation for its support of this conference and its historic support for Cochs. And now, please welcome me in joining Seema Gajwani of the Public Welfare Foundation.